Hello and welcome. Today we're going to talk about recognizing substance use. So let's look at first what to assess. We want to look at physical signs. Look for symptoms such as bloodshot eyes, dilated pupils, or noticeable neglect of personal hygiene. Second, notice emotional signs. Be alert to sudden mood swings, unexplained anxiety, or signs of depression and aggression. Number three, look for behavioral signs. Observe for disorientation, unsteady movement, or impaired coordination. Environmental signs. Look for evidence of paraphernalia such as syringes, pipes, rolling papers, empty alcohol bottles, or unusual chemical odors. Last, look for cognitive signs. Notice difficulties with memory, slurred speech, concentration, or decision making. So the behavioral signs and cognitive signs for many drugs are universal, but some of the most important symptoms to be aware of are routine changes. So if you're at a mobile crisis call, you can ask the family members or the person if they've had any disruptions in daily habits, such as changes in sleep patterns, eating habits, or increased isolation. Are there neglect of responsibilities, decreased performance, or disregard for work, school, or personal duties? Is there any risk-taking behavior, engaging in impulsive or unsafe activities, such as using substance in public or while driving? Do they have memory issues? Are they forgetful, or do they have difficulty recalling events or conversations? Do they have impaired judgment? Are they making poor or irrational decisions, often leading to conflicts or unsafe situations? Is there speech changes, slurred, rapid, slow, or incoherent speech patterns? Emotion, volatility, sudden mood swings, heightened irritability, or defensiveness when questioned? Or do they have just a general loss of interest? Do they have reduced engagement in hobbies, social activities, or relationships? So let's look at the signs of cannabis use. Physical signs. When they use, there's a change in appearance. You'll see bloodshot eyes and dry mouth. Sometimes it's referred to as cotton mouth. Sometimes they'll have unusual symptoms like increased appetite, referred to as the munchies. They might be experiencing lethargy or drowsiness. Physical complaints. They may complain of nausea or dizziness if too much cannabis is consumed. Emotional signs. Do they have mood shifts where they're experiencing euphoria or relaxation? Sometimes they'll experience anxiety or paranoia. Emotional detachment. Do they have difficulty engaging emotionally, appearing indifferent or aloof? Are they irritable? Irritability tends to manifest when they're not using, particularly in regular users. Emotional signs. Are there unusual objects around, like the presence of paraphernalia, such as rolling paper, pipes, bongs, grinders, or vape pens? Smells. Is there a persistent skunky or sweet odor in clothing, hair, or personal spaces? Messiness. Are items left like ashtrays or lighters in unusual places? Let's look at signs of stimulant use. The physical signs are changes in appearance. So this can look like sudden weight loss, dilated pupils, or increased sweating. Do they have unusual symptoms like rapid heart rate, hyperactivity, or excessive energy? Are there physical complaints of dry mouth, headache, or frequent nosebleeds if it's snorted? Do you see emotional signs, mood shifts like euphoria, overconfidence, or intense excitement? This may also include anxiety or paranoia. Emotional volatility, rapid mood swings ranging from extreme elation to agitation or irritability. Irritability, easily angered or defensive, especially during withdrawal or after prolonged use. Environmental signs. You could find unusual objects like syringes, glass pipes, straws, or small baggies with powder or crystals. You can smell smells like chemical or burnt odors in the environment. They could be messy with disorganized spaces due to hyper-focused behavior on specific tasks or neglect of surroundings. Sometimes you'll find lots of unfinished tasks around. Now we're going to watch a video on understanding meth addiction.
Anna. Today we're going to be talking about meth. What is meth? Methamphetamine, also called meth or crystal meth, is a stimulant that creates euphoria and increased energy. Compared to other amphetamines, meth is better at entering the brain, making it more potent and long-lasting. But unlike amphetamines prescribed for ADHD, weight loss, narcolepsy, doctors do not prescribe meth. Meth's legal status, well, the US government classifies amphetamines like meth as a Schedule II narcotic. This means that meth has a high potential for abuse and little medical value. However, doctors do prescribe amphetamines for a specific condition. What are the origins of meth? The University of Berlin created methamphetamine's parent drug, amphetamine, in 1887. Meth was made from amphetamines in 1919 by Japan, but then was shelved. In 1920, the US resynthesized amphetamines and added them to inhalers, decongestants to treat asthma, allergies, and colds. During World War II, Germany used a type of meth called Pervitin, which they gave to their soldiers as a part of an experiment to increase alertness and aggression while suppressing appetite. To this day, certain cold medications contain some of the chemicals needed to create amphetamine. How is meth used? Methamphetamine can be snorted, smoked, taken as a pill, or dissolved and then injected. Meth is usually sold either as a blue or white rock, glass-like fragments, powder, or pills. In its rock or glass form, meth is easy to ignite and smoke. In its powder form, it dissolves easily in liquids, making it easy to ingest or inject. Most meth users follow a binge and crash pattern where they use more, and as soon as it wears off, during these binges, they're usually unable to eat or sleep, so their bodies crash from exhaustion after several days. What does meth look like? Sometimes meth comes in bluish or small white rocks that look like small pieces of hail or ice. Meth can also be a white powder that looks like salt crystals. Meth overdose rates. Methamphetamine overdose rates rose steadily from 1,854 cases in 2010 to 16,167 cases in 2019. The most significant jump in meth overdoses occurred between 2018 and 2019, when 4,000 more people overdosed. Statistically, men are 3 times more likely to overdose than women. And overdoses occur more on meth alone compared to overdoses caused by mixing meth with opioids like heroin or fentanyl. What are the signs of meth addiction? There are many physical signs that someone is abusing meth because it taxes a person's body. Between the constant adrenaline state, insufficient sleep, and not eating, a person using meth will have several symptoms of malnourishment and insomnia. These physical signs include extreme weight loss, unhealthy yellowish skin tones, rotten teeth, also known as meth mouth, wrinkles on the face, sores on the skin, noticeable bags under the eyes, acne, hallucinations, dilated pupils, and poor hygiene. Changes in behavior. One of the first changes is loss of former interests, friends, hobbies, and social circles. Later, other behaviors can become more common, including extreme mood swings, erratic sleep schedules, erratic eating habits, paranoia, rapid eye movement, agitation, hyperactivity, twitching, facial tics, jerky movements, and even tweaking. So what is tweaking? Meth highs can last for hours or days, depending on potency. People will often use more after it wears off to continue the high and avoid the crash. However, when this high becomes impossible to achieve again because their brain and body are too exhausted from sleep and food deprivation, tweaking occurs. A tweaking meth user can be dangerous to be around because they are likely experiencing painful cravings and cannot get high from meth. As a result, they may experience rage, violence, aggression, or even mood swings. What are the side effects of meth? Euphoria, feeling energetic, confidence, talkativeness, decreased appetite, weight loss, insomnia, alertness, agitation, skin sores, acne, rotten teeth, bad breath, losing touch with reality or delusions, hallucinations, violence, self-harm, thinner yellowing skin, premature aging and appearance, paranoia, anxiety, heart failure, malnutrition, and anhedonia, which is the inability to feel pleasure. Street names for meth: speed, crank, ice, shadow, tweak, chalk, wash, trash, dunk, yak, cookie, cookies, Christina, Tina, No-Dose, White Cross, cotton candy, rocket fuel, and even Scooby Snack. What are the meth withdrawal symptoms? Most of those who use meth abuse the drug in cycles because of the symptoms of coming off meth are unpleasant and painful. When a person crashes off of a meth high, their body has a shortage of pleasure and energy transmitters, and it's likely they haven't slept or eaten in a while. Combined, these produce several withdrawal symptoms like drug cravings, itchiness, dry heaving, increased appetite, exhaustion, paranoia, delusions, hallucinations from exhaustion, depressions or suicidal thoughts, mood swings, aggression, irritation, and physical violence. If you, a loved one, or someone you know is struggling with a meth addiction, give us a call.
Okay, so this video really went over all the aspects of meth addiction and the signs and symptoms and how it can look. So let's talk about alcohol use. The physical signs can be changes in appearance, a red or flushed face, bloodshot eyes, or poor personal hygiene. Unusual symptoms can be slurred speech, lack of coordination, or unsteady gait. Physical complaints, complaints of nausea, headache, or frequent hangovers. Emotional signs, mood shifts, alternating between euphoria and depression or irritability. Emotional volatility, increased sensitivity or to criticism or difficulty managing emotions. Irritability, short-tempered or defensive, especially when questioned about drinking. Environmental signs, unusual objects could be presence of empty bottles, cans, or hidden containers of alcohol. Smells, persistent smell of alcohol on the breath or clothing. This is a big one, right? Messiness, neglect of living spaces with signs of spilled drinks or damaged items. Let's talk about opiate use. So, physical signs, changes in appearance, constricted pinpoint pupils. This is a really big sign. Their pupils will get really, really small, pinpoint. Pale or clammy skin or noticeable weight loss. Unusual symptoms might be drowsiness or nodding off, which is like, falling asleep. Slurred speech or slow breathing. Physical complaints, complaints of constipation, nausea, or persistent itching. Emotional signs, mood shifts, alternating between euphoria and apathy or depression. Emotional volatility, increased irritability, anxiety, or feelings of detachment. Irritability, short temper or defensiveness, particularly when withdrawal is approaching. Environmental signs, unusual objects like syringes, burnt spoons, small baggies, or pill bottles without labels. Smells, chemical or burnt odors in personal spaces, and messiness, disorganized living or paraphernalia hidden in unusual spaces. So this next video is on xylazine. This is not an opioid. And I think that there's a lot of information out there about fentanyl, but xylazine is a drug that is continuing to gain ground in the United States. And there's a lot of really intense videos out there about xylazine, but I chose one that's a little less graphic. When you see this drug on the street or people in the ER with it, or when people are coming into treatment, it's very intense. So I tried to find a video that wasn't as graphic. So check this out.
Xylazine 101. Xylazine is a sedative drug that has been contaminating the U.S. illicit opioid supply. It was discovered as an antihypertensive agent in 1962, but wasn't clinically used or FDA approved for human use due to hazardous side effects of sedation, hypotension, and bradycardia. Xylazine is currently only FDA approved for veterinary use as a procedural tranquilizer for large and small animals, where it is known as Anised, Rompun, Xylomed, Cetazine, and Chanazine. Xylazine is not an opioid, but is a sedative with analgesic and muscle relaxant properties. When misused, it is often in conjunction with opioids, which was first documented in the early 2000s in Puerto Rico. Xylazine acts in the brain by inhibiting the release of dopamine and norepinephrine, causing central nervous system depression. While xylazine has been noted as an adulterant primarily in fentanyl, it has been found contaminating other substances as well. Informally, xylazine is referred to as tranq, sleep cut, or anesthesia de caballo, otherwise known as horse tranquilizer. When mixed with other drugs, xylazine can vary in color and texture. And similar to opioids, it can be swallowed, inhaled, smoked, snorted, or injected. Individuals with chronic exposure to xylazine over time have experienced withdrawal symptoms, including anxiety, irritability, and restlessness. People exposed to substances containing xylazine may experience symptoms similar to opioid intoxication, with some exceptions. Here are 3 considerations for harm reduction. First, xylazine can make people very sleepy for many hours, putting them at risk of injury by lying on a limb in a position that could cut off circulation, or even being assaulted. It is important that people never use alone and have a safe place to sit or lay down after using. Second, xylazine may increase the risk of overdose. Because xylazine is often mixed in the illicit opioid supply, naloxone should be administered as soon as possible in cases of overdose. As with all overdoses, call emergency services, administer naloxone, and make sure the individual is placed in the recovery position. Remember that naloxone only reverses the effects of opioids. So if xylazine is present, it is common for people to continue to be sleepy after receiving naloxone. Third, individuals with chronic xylazine exposure may develop skin wounds that take time to heal, regardless of how they used the drug. People who use drugs should be educated to watch for any atypical wounds on their skin and seek medical attention for help treating wounds and monitoring for signs of infection. Based on limited national surveillance data, a rising prevalence of xylazine in the illicit drug supply exists throughout the country. In places like Philadelphia, 91% of fentanyl and heroin samples tested contain xylazine. Xylazine can be tested for in urine and blood at specialty laboratories or detected in drug samples at local drug checking labs. As the presence of xylazine is increasing in the drug supply, it is critical to practice harm reduction and stay informed on the latest data and recommendations.
Okay, so we continually see xylazine in addiction treatment, and it's really important to understand and to know that it's out there, especially when we see overdoses, or just when we're looking at harm reduction and we are talking to people about what is in the drugs that they're taking. You know, xylazine creates these big wounds that they were talking about in the skin, and they can be really, really uncomfortable. So I think it's just important for wound care if you're going to be taking this drug too, something to think about. Okay, the last one we're going to talk about is inhalant use. Physical signs. So you'll see changes in appearance. So you want to look for paint, chemical stains, or residue on the face, hands, or clothing. Unusual symptoms could be frequent nose bleeds, dizziness, slurred speech, or impaired coordination. Physical complaints, be on alert for headaches, nausea, or chemical burns around the mouth or nose. Emotional signs, mood shifts. Note sudden mood swings, euphoria, or apathy. Emotional volatility, increased irritability or paranoia may be present. Irritability, pay attention to defensive or aggressive behavior when confronted. Environmental signs. Unusual objects. Identify paraphernalia such as empty aerosol cans, glues, bottles, or chemical-soaked rags. Smells. Be aware of strong chemical odors like paint or solvents on their breath or clothing. Messiness. Look for signs of spills, stains, or discarded containers in unusual places. So the skill that we're going to learn today is the CAGE questionnaire. The CAGE questionnaire is a widely used and straightforward tool for identifying potential substance use disorders, particularly alcohol dependency. It consists of 4 questions that are easy to administer in a variety of settings, including during a mobile crisis intervention. So here's the scoring. If the person says yes to a question, it's scored as 1 point. A score of 2 or more suggests that further evaluation is needed to determine the presence and severity of substance use disorder. So what does CAGE stand for? C stands for cut down. So a question might be, have you ever felt you should cut down on your drinking or drug use? This assesses concerns about substance use amount or frequency. A stands for annoyed. Have people around you been annoyed? Have people annoyed you by criticizing your drinking or drug use? So this evaluates external feedback and reactions. G stands for guilty. Have you ever felt guilty about your drinking or drug use? This explores emotional impacts like shame or remorse. E stands for eye opener. Have you ever had a drink or used drugs first thing in the morning to steady your nerves or get rid of a hangover? This identifies substance use to withdrawal or stress to mitigate withdrawal or stress, indicating dependence. So here's the strengths of this questionnaire. It's quick and easy to use. It takes only 1 or 2 minutes and it's simple to score. It's non-confrontational. You can frame the questions to reduce defensiveness and encourage honest responses. And it's flexible. So it was originally designed for alcohol use, but it can be adapted to assess other substances with slight modifications. The limitations, though, focus on dependency. It is most effective for identifying substance dependence rather than occasional or risky use. It's less effective for non-alcoholic substances. While adaptable, it may not fully capture the nuance of drug use disorders. And it doesn't assess severity or context. So the questionnaire identifies potential issues, but doesn't explore frequency, quantity, or specific consequences of substance use. Okay, so let's take this into a scenario. Let's talk about Tom here. Background. The Mobile Crisis Unit receives a call about Tom, a 45-year-old construction worker living in a rural community. Tom's wife, Karen, reports that he has been isolating himself, showing up late to work and becoming irritable with the family. Karen mentions finding empty beer cans hidden in the garage and noticing that Tom drinks heavily on the weekends. Karen is concerned because Tom's mood has worsened, and he has recently expressed feelings like he's failing as a husband and a father. When the crisis team arrives, they find Tom sitting in his workshop, reluctant to engage. So the objectives. Objective 1 would be to build rapport with Tom to encourage open communication about his drinking habits. Goal 2, use the CAGE questionnaire to screen for possible alcohol dependency. Goal 3, develop a short-term plan to address Tom's immediate needs and connect him to further support. So here's how we'd use the CAGE questionnaire. First, we want to build rapport. So the team would approach Tom with empathy, normalizing the discussion about his alcohol use. So someone might say, Tom, it sounds like things have been overwhelming lately. We are here to support you, not to judge. Let's start by talking about what's been going on. Tom expresses that he feels stressed about work and financial pressures, admitting that he drinks to unwind after long days. Here's how you'd administer the questionnaire. So the team gently introduces the questionnaire as a tool for understanding how alcohol might be impacting Tom's life. Team member might say, sometimes alcohol can become a way to cope with stress. If it's okay, I'd like to ask you a few questions to understand how it's playing a role in your life. So here's the CAGE questions. Cut down. Have you ever felt you should cut down on your drinking? Tom replies, yes. My wife keeps telling me to stop, and I know it's becoming a problem. The next question, annoyed. Have people annoyed you by criticizing your drinking? Tom hesitates but admits, Karen gets upset with me about it all the time. Guilty. Have you ever felt guilty about your drinking? Tom nods, saying, I feel awful when I drink too much and miss out on spending time with my kids. Here's the eye opener. Have you ever had a drink first thing in the morning to steady your nerves to get rid of a hangover? Tom shakes his head. No, I don't drink in the mornings. So this would be a score 3 out of 4, which indicates a need for further evaluation, but not dependency from this assessment. So developing a plan. The team discusses the results with Tom, focusing on support and next steps. A team member might say, Tom, your answers suggest that alcohol might be adding to the stress you're already feeling. The good news is there are ways to work through this, and we're here to help. Immediate actions. Help Tom schedule a telehealth appointment with a substance use counselor. Provide Tom and Karen with contact information for a local AA group and family counseling services. Safety plan. Discuss strategies to reduce alcohol use in the short term, like setting limits, no drinking on weekends, or exploring healthier coping mechanisms like exercising or journaling. Outcome. Tom feels less defensive after learning that his drinking is being addressed as a medical concern rather than a moral failing. He agrees to attend counseling and check out an AA meeting. Karen expresses relief and gratitude for the resources provided. Now, once again, with this scenario, this might not be a reason that you get called out to a call, but this is an example of how this skill could be used in maybe assessing something else at the call. Like addiction of someone maybe that was being called for domestic violence or something. So, how did the team use the CAGE questionnaire to screen for alcohol dependency? Well, they framed the questions non-judgmentally, which is very important, and normalized the discussion of drinking habits. So this really takes the stigma and shame away when you do this, the non-judgment and normalizing. What strategies helped Tom feel more comfortable opening up about his drinking? So they built rapport through empathy and explaining that alcohol use can be a common response to stress, because that's true, right? How did the team address both immediate and long-term needs? Well, immediate needs were met through a safety plan and scheduling counseling, while long-term needs were addressed through referrals to AA and family counseling. So the key takeaways, early intervention. So recognizing behavioral and cognitive signs of substance use is crucial for early intervention. Substance use signs, understanding specific signs of drug use enhances assessment accuracy. And using the CAGE questionnaire provides a quick and effective screening tool for alcohol or drug dependency. All right, thank you.